Hi, I'm Tammy Swing. I'm your clinical care specialist covering ambulatory.
And hi, I'm Bonnie Grunewald. I'm your clinical education specialist in CPDP, and I cover ambulatory. Today we're going to talk about respiratory rate, an important vital sign, especially in patients coming in who have ill symptoms. So when you first come in the room, of course, you're going to perform hand hygiene. And when you come over to room your patient, you're going to look for signs of respiratory distress. First of all, we want to look at the face and around the mouth to see if there are any signs of cyanosis, which is a blue tint to the skin. Another thing we want to look for is retractions. Retractions is a sign of respiratory distress, and what you're looking for is when the skin is pulled real taut over the ribs, signaling that the patient is struggling to get a breath in. Also, tripod position is another key indicator of respiratory distress in a pediatric patient.
You also may see some nasal flaring, and that is because of the struggle to get air, especially in infants who breathe through their nose most often. So you'll see that flaring, trying to catch that breath.
All right, so let's demonstrate how to do a respiratory rate correctly on an infant.
So one of the best things to remember is you don't want your patient to know that you're taking the respiratory rate, because that can alter how they'll breathe, and you won't get an accurate reading. So in an infant, the best method probably for you is to use your stethoscope. So if you're already taking that apical pulse for a minute to get a good heart rate, then you just extend it for another minute and listen for the breath sounds. Okay, so for an infant, it's important to get an apical heart rate. So to get the respiratory rate, what you can do is go ahead and the minute after you've done your heart rate, just go ahead and listen for those breathings. So count 1, 2, 3. Of course, you count to yourself. You don't want to make your patient aware that you're checking their breathing.
And it's important that we count for a full minute, no matter what age we are getting this vital sign on, because especially with infants, they have different breathing patterns, and so their breathing is not always normal like an older pediatric patient. So a full minute is what is recommended.
So if the patient is a little older, or for whatever reason you don't have the stethoscope to use, another method is to just look for the chest rise. If in an infant you don't necessarily see the chest rise, we can see it here, but for some cases you may not see it, and then you would just listen or watch the abdomen rise, because infants often breathe with their abdomen.
And while we're doing a regular pulse on a patient, and this is an older pediatric patient, you can take your pulse for a minute. And same thing that we would do with the apical pulse is just extend that time for another minute without telegraphing to the patient that you're counting respirations. You can be looking at your watch for the minute, and out of the corner of your eye, you can be looking at the patient's chest and abdomen and counting those respirations. And of course, you want to do that for a full minute.
And if you really just can't see, you don't have your stethoscope, you can't see the chest rise, you can't see the abdomen, you can, on a younger child, you can go ahead and put your hand and feel that rise.
Now you want to make sure you place the hand on lightly so you don't disrupt their breathing.
Right. And that's probably not going to work as well on an older child, because again, it might telegraph what you're doing. And then you have to be sensitive as the patient gets older. Watching their chest is not comfortable for some. Of course, not touching is important, especially without permission. So in those cases, the way Bonnie demonstrated while doing the pulse is probably your best way. Or another thing you can do is have the patient facing away from you. You're listening on the other side, or you're just having them turn slightly. So while you're listening to their heart and listening for their lungs, they're not seeing you watching their chest rise.
An important tool For any other questions or any clarifications is the standard work document found on StarNet, which shows you from start to finish how to count respiratory rate.
And it also has a table that's based on Lippincott of the common respiratory rates or normal respiratory rates based on a patient's age. So it's important to, that you see that, you know where that table is, so when you're looking at it, you have some idea of what to expect.
Please reach out to your supervisor or manager or Tammy or I if you have any further questions about getting a respiratory rate.